Guillain-Barre syndrome, autoimmune disease of peripheral nervous system. Peripheral nervous system includes all the nerves and ganglia that connect the central nervous system and the rest of the body. Central nervous system includes brain and spinal cord, whereas peripheral nervous system includes cranial nerves and spinal nerves. Spinal nerves, 31 spinal nerves, cranial nerves, 12 pairs of cranial nerves are involved in peripheral nervous system. Now we know the definition of Guillain-Barre syndrome, which is the autoimmune disease of the peripheral nervous system. Now we will discuss about the variants of Guillain-Barre syndrome. Among the variants, most common is acute inflammatory demyelinating polyneuropathy. Among 70%, it is common. Acute motor axonal neuropathy, acute motor sensory axonal neuropathy, Miller-Fisher type or descending Guillain-Barre syndrome, which has a triad of ophthalmoplegia, ataxia, erythraxia. It is a triad of Miller-Fisher type. Now we will discuss about the autoimmune pathophysiology. Mainly triggering factors of Guillain-Barre syndrome involves infections. Most commonly infections. It involves both cell-mediated immunity and humoral immunity. In case of infection, bacterial infection like Campylobacter jejuni. Guillain-Barre syndrome occurs after the diarrhea. Viral infections includes cytomegalovirus, Epstein-Barr virus, HIV, Zika virus. Vaccines like H1N1, COVID. Another triggering factors includes pregnancy. Surgery also triggers the Guillain-Barre syndrome. Now we will learn about the pathophysiology of Guillain-Barre syndrome. For examples, if a person has Campylobacter infection, against infection, immune responses starts in our body. Antigen presenting cells, T cells, B cells are stimulated and the antibodies are formed. These antibodies have molecular mimicry. Some parts of the Campylobacter jejuni have similar features with myelin sheath. So these antibodies which are formed against Campylobacter are cross-react with the myelin sheath and causes the demyelination of the nerves. This is the pathophysiology of the Guillain-Barre syndrome. What are the core features of Guillain-Barre syndrome? Majorly radiculopathy, pain, weakness.